It is TikTok Tuesday, and some users are sharing hacks for thicker hair.
Everything from diet tips to sprays like rosemary oil and sea salt, even medications. But what really works? Dr. Michelle Henry is a board-certified Harvard-trained dermatologist joining us live to give us a scoop on all this. Good morning. Welcome to Houston's Morning Show.
Good morning. Thank you for having me.
Let's first of all just start talking about what's going on with hair in the first place. What can cause it to thin out sometimes?
You know, a lot can contribute to hair loss. The biggest contributor is genetic. So female pattern and male pattern hair loss is something that we actually inherit from our parents and our families. But there's also telogen effluvium, which can happen from stress. Both physical and mental stress can cause hair loss.
We're also seeing hormonal changes and just aging as well, you say, doctor. You know, everybody is always looking for that magic fix, and people spend hundreds, thousands of dollars trying different products. What do you suggest we do to get thicker hair?
You know, the first thing is to see a dermatologist to find out the cause. So as you said, there are many different causes for hair loss. If you have the most common causes, there are some things you can do over the counter. So one, diet. So diet is critically important. We literally are what we eat. So making sure we have diets full of lean proteins. Things like eggs. Eggs contain protein and biotin, which is absolutely important. Healthy fat. So salmon, avocado is really important for the luster of your hair. Gentle products, so sulfate-free shampoos are really critical so that we're not stripping and damaging our hair. Low heat is really important. So it's what we put in and what we do on the outside is really critical to establish the balance for healthy hair.
Yeah, because shampoos and conditioners are not all created equally, are they?
Absolutely not.
What should we be looking for? Perhaps is there something in there, because we keep hearing sulfate-free shampoo are really popular these days. Do those harsh chemicals really cause a difference in your hair and its strength? Thickness?
Absolutely. So sulfate is one of the harshest cleansers. So it's going to take away dirt, oil, and debris, but it's not giving you anything back. And you end up with brittle, dry hair, especially if you have chemically treated hair, especially if you have dyed hair. Stay away from sulfates. Make sure you're using a conditioner. You know, we're busy in the morning. A lot of people don't want to use conditioners. Conditioners are critical. Your moisture balance is really important so that your hair does not break. You know, using those shampoos and conditioners that have ingredients like hyaluronic acid, that's really great. Vitamin B5 is critical for the strength of your hair. So really looking for smart products.
All right, what about the essential oils and something like rosemary oil? I've seen people put that on their scalp to help their hair grow. Is there any truth to that?
So there is some truth. So rosemary oil is a huge TikTok trend. So rosemary is actually a medicinal plant. And so what it does is it helps to increase the circulation. So there's a very tiny study that compares rosemary oil to minoxidil, which is the FDA-approved treatment for hair loss. And it shows that it's equivalent to 2% minoxidil. So of course we need larger studies, but it is safe to use when used appropriately, and it provides a nice natural solution to get a little bit more hair growth.
Also trending on TikTok is sea salt spray. I don't even understand what that is, but what is your thought about that?
So sea salt spray is used commonly to volumize the hair. It makes the hair look temporarily thicker, but just temporarily. It does not cause long-term stimulation of hair growth. And actually, if your hair is color treated or dyed or chemically treated, you may not want to use it. It may cause significant dryness and breakage.
All right, so Dr. Henry, just to be clear, there's nothing FDA approved except for minoxidil or Rogaine, nothing else that you would necessarily recommend?
Well, over the counter, there's minoxidil. That is the FDA-approved solution. However, in our office, we have a lot of options. So I use things like oral finasteride is really popular with a lot of my male and female patients. I use many different minoxidil compounds. I use PRP, which is platelet-rich plasma. So we draw your blood, we activate those platelets, and we inject it into the scalp. That works quite well. I even use a laser. It's one of the newest lasers. It's called the TED. And what it does is it helps increase the uptake of really specific growth factors for the scalp. So we have many options, even hair transplantation after we've exhausted all medical treatments. But I have a really full hair restoration practice, so we have all of the tools, and there's a lot that we can do.
Sounds like you name it, you've got it. Well, thank you for taking time to walk us through all of this and help us separate fact from fiction. Great to see you this morning.
See you. Thank you.